Secret number 9. Also a secret that involves the use of diagnostic studies. Secret number 9 is to analyze for loss of motion segment integrity. Now, I want to ask you doctors, just like we did with the gait analysis, raise your hand if you do a formal analysis for loss of motion segment integrity on every single spine case. Raise your hand. No? You don't do it on every single case? Do you do it on every other case? Every third case? Do you do it at all? I'm going to encourage you to perform an analysis for loss of motion segment integrity on every single spine case. And the procedure for doing so is described in the AMA guides on pages 378 and 379. And it basically involves two methods. It involves an analysis using measurements of vertebral translation. In other words, anterior to posterior shifting of one vertebrae on another. And it also involves a measurement of angular motion. So there are translation measurements and there are angular motion measurements. And I'm going to go through an analysis of motion segment integrity. For those of you that have the PowerPoint presentation, you will be able to watch along as I go through this. Those of you that are simply listening to this on audio program are going to miss the step-by-step procedures whereby motion segment integrity is analyzed, but you'll at least hear my narration here on the audio portion of the program, and I encourage you to go back and look at the PowerPoint presentation so that you will have the materials that you need to do an analysis of motion segment integrity on your very next case. And also in the PowerPoint presentation, I provide a template for you to use to report your findings, and you can simply cut and paste that template into your very next report. Okay, so a couple of suggestions about performing an analysis of motion segment integrity. First of all, of course, this requires appropriate x-rays. And for the time being, let's just focus our attention on the lumbar spine. Of course, everything that I say would apply also to the cervical spine, but for this example, we're going to focus on the lumbar spine. So in order to measure lumbar spine angular motion, you need to have flexion and extension radiographs of the lumbar spine. And I always get these studies done at a local imaging facility where the x-rays are processed digitally. And having them processed digitally provides you with the measuring tools embedded right in the software that you can use to perform your measurements and assess the angular motion. So get the x-rays done and recorded digitally. If you have an old x-ray machine and sometimes the quality of your images is not ideal, you're going to want to upgrade your images in order to perform accurate analysis of motion segment integrity. And it's worth sending the injured worker out to a local imaging facility. And remember that the whole philosophy of this program is to increase the persuasion power of your reports. And nothing is less persuasive than low quality, non-diagnostic x-ray images. You are responsible and you want to make sure that the images that you get are of tip-top quality, perfect diagnostic quality. If at any time you are dissatisfied with the quality of images that you get from your local imaging facility, insist that the injured worker be brought back and that the images be taken better, whether that require different factors or different patient positioning, whatever. But you are responsible for ensuring the quality of the images. And it's also important to note that you may have a deposition on this particular patient, and you may be asked in the future, well, what did the studies show? Or you may be asked to demonstrate how you came up with your conclusion that there was a loss of motion segment integrity, or that there was a spinal anomaly, or whatever. I'm just using this as an example. And the images upon which you rely have to be perfect. Insist on perfect images. So get them done at a local facility where they have million-dollar equipment and everything's digital. Also, make sure to provide instructions to the X-ray technician that they stabilize the pelvis. During flexion and extension to minimize hip motion. We're after pure lumbar spine motion. Okay, and so with those instructions in mind, we're going to go through a procedure for doing an analysis of lumbar spine motion segment integrity. And I refer you to the PowerPoint presentation where this is laid out for you in step-by-step fashion. Okay, so to begin with an analysis of a lumbar spine motion segment integrity, begin with your neutral lateral lumbar projection. And begin by measuring the lumbar lordosis. The lumbar lordosis is measured from the superior end plate of L1 to the superior end plate of S1. Measure that angle and record that angle at the bottom of your template, and I provide that template for you. Record that at the bottom of the template in column 1. So here, for those of you that are watching the PowerPoint presentation, I've measured the lumbar lordosis. I have here a neutral lateral lumbar X-ray projection. I've measured the lumbar lordosis from the superior end plate of L1 to the superior end plate of S1, and the software that accompanies your digital images contains measuring tools that allow you to do this in 1 second, and it provides the angle for you. And in this case, the lumbar lordosis is normal at 60 degrees. So imagine this: we have a lumbar lordosis angle of 60 degrees. We're now going to put the injured worker through movements of flexion and extension, and that lumbar lordosis is going to change from its neutral position of 60 degrees. It's going to reduce as the spine goes into flexion. It's going to increase as we go into extension. And measuring the lumbar lordosis angle in the neutral flexion position gives you a starting point. It gives you a baseline value from which you can make your assessments as the spine globally and individually as individual segments goes into flexion, and then globally and individually as each of the vertebrae go into extension. And it allows you to be able to assess for motions from baseline in both flexion and extension. Okay, so we have our lumbar lordosis angle at 60 degrees. We've recorded that in our table. And for those of you that are on the PowerPoint, I'm referring now to the table, and it shows that I've input the lumbar lordosis angle of 60 degrees at the bottom of column 1. Those of you that are listening to the audio program, I provide this template for you in your handout materials, so this would be a good time to pull out that template and follow along with the narration. Once we have the global lumbar lordosis angle in the neutral lateral position, we then measure the intersegmental angles, beginning with the angle between L1, L2, then the angle between L2, L3, then the angle between L3, L4, etc., down to L5, S1, and record those measurements also in column 1 of your table. Now, you might be thinking, well, wait a minute, why are we doing these measurements on the neutral lateral? We're supposed to do these measurements on the flexion and extension views, and that is true. But adding this one extra step of measuring the global lumbar lordosis and then the intersegmental angles on the neutral lateral gives you your baseline. It gives you your starting point from which you can see how the spine is moving from your baseline values as the spine goes into either flexion or extension. So it allows you to get a starting point of each of the intersegmental angles. And I'll elaborate on that a little bit more. So here on the same lateral lumbar radiograph, I measured the lumbar lordosis. It was 60 degrees. I've now measured the intersegmental angles by drawing a line first from the superior end plate of L1 to the superior end plate of L2. That angle measures -8 degrees. And by the way, doctors, you need to be very careful of your pluses and minuses. Minus degrees indicate that the angle is in extension. It's in a lordosis. Negative angle indicates extension lordosis. I've next measured the intersegmental angle from L2 to L3. That angle measures -10 degrees. From L3 to L4 measures -9 degrees. From L4 to L5 measures -11 degrees. And from L5 to S1 measures -19 degrees. You then take those figures and you input them in your table. So we now have the intersegmental angles from L1 all the way to S1, and we also have the global lumbar lordosis. And those numbers should coincide. So, for example, if we take all the intersegmental angles, which I said were -8, -10, -11, -14, and -18, if we add those all up, those should equal the global lumbar lordosis angle, which is -60 degrees, and in this case it does. So we now have established our baseline values, and we can use those baseline values to analyze the motion of the vertebrae as the vertebrae goes through both flexion and extension. Okay, so the next step, now that we have our baseline values, is to repeat the procedure on the flexion radiograph and then again on the extension radiograph, and look at how each of the vertebrae are moving. Okay, so the next step in the procedure is to measure now the lumbar lordosis on the flexion view. We started by measuring the lumbar lordosis on the neutral lateral. Now we're going to measure the lumbar lordosis on the flexion view. Record that at the bottom of our table. Then we're going to measure the intersegmental angles, just as we did before on the neutral lateral view, and record those measurements in the table. So here is the flexion radiograph. It's an excellent radiograph. I can see all the structures, including trabeculi of the lumbar spine vertebra. and measuring from the superior end plate of L1 to the superior end plate of S1, I see that the lumbar lordosis angle is minus 10 degrees. Now recall that when we started on the neutral lateral film, the lumbar lordosis was minus 60 degrees. So now in moving this injured worker into full lumbar spine flexion, the lumbar lordosis reduces to 10 degrees, a change, I should say minus 10 degrees, I'm sorry, a change of minus 60 minus 10, which is 50 degrees. So we've lost 50 degrees of lumbar lordosis in moving from neutral lateral to full flexion. That loss of 50 degrees of lumbar lordosis is distributed among each of the individual motion segments. So now when we measure each of the intersegmental angles and compare the changes of those angles from the neutral lateral, those changes should all equal minus 50, or should equal 50 degrees of change. So here on the same neutral lateral, I've now measured the intersegmental angles, and the intersegmental angles here measure plus 1 degree, which indicates that the lumbar spine vertebrae is in a position of flexion. The next one, L2, L3, is plus 2 degrees. The next one, L3, L4, is 4 degrees. L4, L5 is minus 6 degrees. And L5, S1 is minus 10 degrees. Record those in your table. And you can see here that I've recorded those on the table in column 2. Next step. Now we're going to calculate the delta F. Delta F. Delta F is the change in, number 1, the lumbar lordosis angle, and 2, it's the change in each of the intersegmental angles in moving from neutral to full lumbar flexion. We record those changes, which we call delta F, in our table. And here, make a mental note of the figures and assess for loss of motion segment integrity, meaning that there's either too much motion or too little motion. So, referring back to our chart, you can see that when we started in the neutral lumbar lordosis at L1, L2, the intersegmental angle there was minus 8 degrees. When we went into full lumbar flexion, the intersegmental angle changed to positive 1 degree, indicating a flexion position of that intersegmental angle. That is a change of delta 9. That lumbar motion segment at L1, L2 moved 9 degrees from neutral position to full lumbar flexion. That indicates that that's a movable segment. It's moving 9 degrees. At L2, L3, the change in flexion angle was 12 degrees. At L3, L4, it was 15 degrees. At L4, L5, it was 8 degrees. At L5, S1, it was 8 degrees. And if you just look at that chart, you can see that the most mobile segment in lumbar flexion was L3, L4. And if we add all those delta F figures, you'll notice that it comes to 50 degrees, and that exactly coincides with the change in the global lumbar lordosis angle from minus 60 degrees to minus 10 degrees. So we're on the right track, and all of our numbers are coinciding and are substantiating our findings. Now we're going to repeat the same procedure on the lumbar extension film. We're going to measure the lumbar lordosis in extension, recorded at the bottom of the table. We're going to measure the intersegmental angles from L1 to S1, and we're going to record those also in the table. So here's the lumbar extension film. I've measured the lumbar lordosis angle. That angle is 66 degrees. So let's refer back. In the neutral lateral position, the lumbar lordosis was 60 degrees. Now in full lumbar extension, we have 66 degrees, a change of 6 degrees. Well, that's not really a lot, considering that 6 degrees is distributed over 5 vertebrae. So that in itself indicates that there's some restriction to motion in lumbar spine extension. So let's find out where that restriction is. Okay, now you can see on this image that I've measured the intersegmental angles. The intersegmental angles from L1 to S1 are as follows: -9, -10, -12, -13, and -22. And we're going to input those into our table. And you can see here on the table I've input the global lumbar lordosis, which is -66 degrees, and then each of the intersegmental angles from L1 to S1. As we did before, we're going to calculate the delta E now, which is the change in lumbar lordosis angle in moving from neutral to extension, both globally and then in each of the intersegmental angles. And again, we're going to make a mental note of the figures, and we're just going to sort of mentally assess for alterations of motion segment integrity, whether there's too much motion or too little motion. So back to our table, and we can see that I've filled in the delta extension column. Delta extension column indicates that in lumbar extension, the L1, L2 motion segment moved from -8 degrees in the neutral position to -9 degrees in the full extension position. This is a change of 1 degree of motion of the L1, L2 motion segment. That would indicate to me that there's some restriction in that motion segment in the motion of lumbar extension. So just make a mental note of that. At L2, L3, the delta extension degrees is 0, meaning that in the neutral lateral position, the intersegmental angle at L2, L3 was -10 degrees. In full lumbar extension, it also measured -10 degrees, indicating that there's no motion of that vertebrae in the movement of extension. In fact, if you look, okay, I'll hold that discussion. So it's basically fixed or immobile in extension. At L3, L4, only 1 degree of motion. At L4, L5, only 1 degree of motion. At L5, S1, only 4 degrees of motion. And if you add those delta figures up, it comes to only 6 to 7 degrees of total motion for the entire lumbar spine, moving from neutral lateral to full extension. And that coincides with our changes in global lumbar lordosis angles of -60 to -66 in extension. So what would you conclude here? I conclude that there's relative immobility of the spine in moving from neutral lateral to lumbar extension. In fact, one of the vertebrae, levels, one of the motion segment levels at L2, L3 demonstrates 0 degrees of motion. So this quickens our thinking to perhaps the possibility that there is a loss of motion segment integrity somewhere here in the lumbar spine. And by doing our analysis first, by comparing flexion and extension to the neutral lateral, it gives us an idea where those losses of motion segment integrity lie. In this case, it appears that they lie in the movement of lumbar extension, because there's very little movement of the spine in lumbar extension. Okay, next step in our procedure, according to the AMA guides now, is to calculate total angular motion. And be particularly careful with your plus signs and your positive signs. I have to be honest, I have once lost track of my positive and minus signs, and I awarded permanent impairment for loss of motion segment integrity simply on the basis that I assigned an incorrect angle to one of the intersegmental motions, and that can make a significant difference. So make sure to keep track of your plus and minus signs. Remember that lordosis angles are negative angles. And once you've calculated total angular motion, then you can make an assessment of motion segment integrity. So here on our chart, I've calculated the total angular motion, which is the motion of each individual motor segment in moving from the extreme of lumbar spine flexion to the extreme of lumbar spine extension. So we use the equation that total angular motion equals the flexion angular motion minus the extension angular motion, and keep careful track of your positive and minus signs. Lordosis angles are indicated by a minus sign. Flexion angles are indicated by a plus sign. So I've performed those calculations all the way from L1 to S1, and we see that at L1, L2 the total angular motion is 10 degrees. At L2, L3 the total angular motion is 12 degrees. At L3, L4 the total angular motion is 16 degrees. L4, L5 is 7 degrees, and at L5, S1 is 18 degrees. And that total angular motion, you can use your intersegmental angles and correlate those to the global change in the lumbar lordosis angle, moving from the extreme of lumbar flexion to the extreme of lumbar extension. And in this case, that equates to minus 10 degrees of lordosis, minus 66 degrees of lumbar lordosis equals 56 degrees of total angular motion, and that should correlate with the changes in, that should correlate with the total angular motion of each of the individual motor segments, and in this case it does. So now you have to make an analysis, a decision regarding whether or not there is alteration of motion segment integrity or not. Now, how do you decide? Well, you go to the source. The AMA guides tell us. They tell us on pages 378 and 379, it says, in the lumbar spine, there is a gradual increase in flexion extension movements from about 12 degrees at L1 to L2 to 20 degrees at L5S1. Starts out at 12 degrees at L1, L2 and increases gradually to about 20 degrees at L5S1. Well, let's think about it. If it was 12 degrees at each level, which it's not, it says the AMA guide says it increases to 20 degrees at L5S1, but let's just say that it was 12 degrees at each level. Well, there's 5 levels. That would be 60 degrees of total angular motion. Well, our example just produced 56 degrees, so we're close. But the AMA guys say that it increases from 12 degrees to 20 degrees. Well, let's say it was 12 at L1, L2, and 14 at L2, L3, and 16 at L3, L4, and 18 at L4, L5, and then 20 at L5S1. That would be, well, what would that be? Let's add this up. Let's add this up. 12 plus 14 plus 16 plus 18 plus 20, that would be 80 degrees of angular motion, total angular motion. In our example, we just had 56 degrees. So there's some loss of normal motion segment integrity. So let's go to our chart. We find that at L1, L2, we have 10 degrees of total angular motion. Well, the AMA guides say that we should have roughly 12. So that could indicate some loss of motion segment integrity. In this case, I opined that that was within normal limits, and I described it as normal. At L2, L3, we had 12 degrees of angular motion. I described that as normal. At L3, L4, we're increasing and showing increasing angular motion, which is what the AMA guides describe. I described that as normal. Now, before I go on, even though I considered the angular motion of L1, L2 to be normal at 10 degrees, if you look at our analysis across the top of this table, remember that in moving from neutral at the neutral lumbar lordosis angle to the full extension angle, there was only a movement of 1 degree going from neutral to full extension. So the bulk of the motion of this motion segment is found in lumbar flexion, with very little motion in lumbar extension. So even though the global range of motion at 10 degrees is roughly consistent with what the AMA guides describe as normal, which would be 12 degrees, you might argue that there's a loss of motion segment integrity in moving into lumbar extension, and in fact that there's a loss of motion of the spine in extension. You could opine that with this chart as I've given it to you this way, and that's why I recommend that you use the chart like this, because it helps you break down the angles and the motions of the spine into smaller subsets. And if you think that there's a loss of motion segment integrity, you now have the support for it. And this chart and your x-rays and your measurements, assuming that the x-rays are perfect and the measurements are accurate and that you stand behind them, this could support your conclusion for a loss of motion segment integrity at this level. Continuing down, we see that at L4 and L5, total angular motion is 7 degrees, only 7 degrees, and the guides say that as we get closer to L5S1, we should be approaching 20 degrees. So certainly this represents a loss of motion segment integrity at L4, L5. Similarly, at L5S1, we have only 12 degrees of total angular motion. So this also represents a loss of motion segment integrity.